to this. I am the acting director for the Division of Child and Adolescent Health, and that is probably a new name for all of you. So I just wanted to briefly give an update about an organizational change that has happened. We have had a recent reorg in our department, and a new bureau was created, the Bureau of Family Health Services. And within that bureau is the former Division of Family and Community Health, which has now been split into two divisions. We have the Division of Maternal and Infant Health, which is led by Brenda Fink, and the Division of Child and Adolescent Health. The local MCH team, Trudy Esch and Robin Orsborn, and myself, we reside in the Division of Child and Adolescent Health, although the two divisions will work really closely together around the MCH Block Grant and MCH in particular. So with that being said, we're going to go around and do some introductions here in Okemos.
I'm Trudy Esch. I'm the Maternal Child Health Nurse Consultant.
Erin Madden. I'm a research assistant here at Michigan Public Health Institute.
This is Julia Heaney. I'm the program director of the Center for Healthy Communities at the Michigan Public Health Institute.
Hi, I'm Lauren Lapine. I'm a research assistant here with Michigan Public Health Institute.
This is Robin Orsborn. I am the Medic Outreach and Local Maternal and Child Health Consultant.
Great. Is the team here today that will be a part of this webinar. On behalf of our department and our friends and colleagues from MPHI, we just want to welcome you to today's webinar and to thank you all for taking a leap of faith with us and joining us on this project. We know we didn't give a lot of details when we first talked about it, mostly because we were still working them out. And we're happy to report that all health departments are participating in this process. And so we're excited to share some of the details with you today, and that really is the plan for today's webinar. We'll have some opportunities for questions at the end. And with that said, do we have any housekeeping items?
I think one housekeeping item would be to remember to put your phones on mute if you haven't done that already. But please be careful not to put your phones on hold, because that bring music to all of us that might be hard to speak over. So if you could put your phones on mute but not hold, that would be awesome.
And with that being said, we will turn things over to Trudy Esch, and then eventually we'll be handing over the reins to MPHI.
Everyone, I'm so glad that you could all join us. First, the couple of slides that I'm going to talk about is some background information, and for those of you who were on our webinar for MCH, some of this is a little bit redundant. I wanted to give you that overarching background of what's going on with Title V from the federal level and at the state level, so that it makes sense about why we're asking you to do what we're asking you to do, and why everybody knows how important needs assessment and community assessment is to public health, but how does that link in then with how Title V is federal. So that is the news, I guess, is that Title V is being transformed at the federal level. The federal government had not changed the performance measures in a number of years, not since 1998. And so they really wanted to take a look at what it was that they needed to have the need to move on to reduce infant mortality and maternal mortality from a federal perspective. So they did their own needs assessment and picked new performance measures, which we have already previously shared with you. I also wanted to make sure that the states were had enough flexibility so that they could do what was important to their state. As you all know, Michigan is a rural and urban state, has rural areas and urban areas, and some states are very urban, some states are very rural, some states are mixed like us. So they wanted to make sure that states could still be very flexible with what they do with the Title V funding. Because so flexible, there were a variety of data sources, and things were so all over the map as they were trying to measure things. So the federal government is working with us to try to populate some of our data sources for our annual reporting. There were some previous challenges that they had when they were comparing measures, because sometimes they weren't always comparing like data to like data. So all of this resulted in this transformational process. And the underlying thing with the transformational process, I think, is that they want to be data-driven and evidence-based, which are buzzwords that all of us are familiar with. So, that transformation, some of the goals that Bill 5 has is we have to do our 5-year major comprehensive needs assessment for the state. And as we were doing our needs assessment and as we've been looking at the work plans, we're fortunate that we had the ability to be able to offer this one-time funding in fiscal 17 so that local health departments could participate in MCH needs assessment and creating priorities. What we know, and I know we'll be emphasizing this as we go along, but in 45 health departments, everybody, because all health is local, has their own way that they've been looking at needs assessment. People have had the good fortune of having good resources so that they've been able to really do very thorough needs assessments. We have some local health departments that have gotten their accreditation. We have some people that have gone through other variety of needs assessment processes. And we have some health departments who maybe like to do more with their needs assessment, but have not been able to because maybe they don't have staffing resources or other financial resources that they need to be able to get things done. So we have, sort of both ends of the spectrum and anything in the middle among the 45 health departments that have. So we're excited to be able to offer this one-time funding and to be able to get everybody sort of on the same stage of a specific model. Obviously, there's many models that you can use for needs assessment. The $15,000 is available with the Second Amendment, and I'm just going to put a plug in for the First Amendment because we can't release the Second Amendment until the First Amendment's done. So for those of you who are still working on that, we'd appreciate it if you could get them so we can get the Second Amendment and this one-time funding release for you. It should be available then on January 1st and go through the end of the fiscal year, September 30th of 2017. From a logistical perspective, we talked about doing national performance measures, state performance measures, and local performance measures. So this is one of those local performance measures that is for needs assessment project, and it will be housed in the project called Public Functions and Infrastructure. So for you that already have local MCH funds in there, money will be added to that project pot. For those of you who don't have any local MCH funds in that project pot will be open for you in the Second Amendment. You know, whenever there's a new local performance measure, any performance measure or funding change, the local MCH plan and work plan needs to be updated, and we really wanted the work that you do for this project to be concentrated on the few work that we need to do. So in the end, we created a work plan template for you, which we will send out to you after this webinar. You can template as is. If you feel like you want to adjust it to make some local changes, you certainly are welcome to do that. What we're going to have you do with the Second Amendment is just upload that work plan into eGrams on that Public Health Functions and Infrastructure project. We'll be asking you to identify a leader on that particular work plan for this project. We will be creating a listserv so you can communicate with at least one person about this particular project. And if not on the project, then we don't have to sort of bug you with email about it. So anybody that wants to be on the listserv, we're happy to put on there, but we don't want to create extra emails and work for people that aren't involved. I think, let's see. So an MCH needs assessment framework, which we'll be talking about, Julia will be talking about shortly, and she'll be talking about webinars that we're going to ask you to participate in to outline the framework. And we are recording the webinars, so you'll be able to hear them if you can't get them in real time. This slide just shows a snippet of the, it's way too small to see, but it's just a snippet of the work plan the work plan template that we developed and the cover page. So like I said, we will send that out to you probably early next week so that you'll have that when the Second Amendment is released. Now.
Thank you, Shirley. Good afternoon, everyone. I'm delighted to be here with you today, talking a little bit about what our idea and vision is for working with you through this needs assessment process focused on maternal child health. when Carrie and Robin and Trudy first talked with us about sort of their vision for this project and where they wanted to go, we came up with a couple goals that we hoped that we'd be able to achieve. And the process that we came up with is in line with those goals. We thought we'd jump right into sharing those goals for this work with you as we get started today. So would like for this process to lead to an increased understanding of maternal child health status and disparities in MCH outcomes across health departments in the state. So at the state level, in the 5-year needs assessment that was completed not years ago, we learned more about that at the state level, but we recognized that that exploration at the state level was less locally informed than we would like it to be. So we wanted to learn from what you find through that exploration process, and want you to have that same benefit of learning about health status and disparities by going through a needs assessment process similar to what the state did. Also like to have a deepening understanding of MCH needs identified by community partners and families. So we want to make sure that the process that we come up with is informed by your partners and informed by the voices of those that you serve. We process to help us to identify the strengths as well as the gaps in MCH infrastructure. We all know that you have to have public health functions strong and in place within your department in order to be able to achieve your goals for community health. You have to have good infrastructure for surveillance, for monitoring data, for assessment, for planning, for policy development, for enforcement. So we want to learn more about where the strengths are for health departments in those areas as well as where the gaps are. So the process is designed to help us learn more about that as well. We want this process to be very data-driven. Consistent with the transformation of the Title V grant, we want to support the whole system in using data to identify needs and priorities amongst those needs. In this process, we want to have clear goals and SMART objectives that are responsive to those priority needs, and we want to support using evidence-based strategies to meet goals and achieve objectives. Both those that are by Title V funds or supported through Title V funds, but then just broadly within your department and within the system. So a little bit more background on where this came from, at least from the MPHI perspective. The MCH leadership at the state, when the transformation was announced and more information was coming down about that, they reached out to us at MPHI to say, you know, this transition is really consistent with where we want to go anyway. We want to have a more robust needs assessment process that we're working with. We want to incorporate needs assessment into our practice on a more ongoing basis. We want to make sure that we are making data-driven decisions about where we put resources, where we create resources, what we emphasize in terms of improving or changing the way that we're working. And we see this as a lever to accomplish that. So they put $15,000 into a contract with us to support achieving that kind of goal of using this Title V needs assessment to kind of more broadly inform maternal child health needs and priorities at the state level, thinking about what could be supported by Title V and what might be supported by other funding sources. And through the process that they went through and went through that, they kind of came to that conclusion of, gosh, what we did at the state level, we learned so much if this was also done at the local level, and we want local health departments to have that same opportunity for that in-depth exploration of data and thinking about what it means and talking with partners about what it means so that they can have these same sorts of learnings about where their communities are and what their priorities are. So I have to share that to kind of reinforce the idea that what you'll be going through over the next several months is very consistent with what the state went through. And from my vantage point, it seems to me that what the state is trying to accomplish is providing the support to give you an opportunity to learn the same kinds of things, to discover the same sorts of things that the state was able to discover through going through a similar process. So as sort of designed this and thought through what it would look like, we have two sort of competing things that we've been thinking about. We've been trying to balance rigor with flexibility. So there are some critical features that we've identified for the needs assessment process that we think of as being sort of non-negotiable aspects of what we're hoping this will look like. Critical features of needs assessment, this process, or really any needs assessment process, are that partners are engaged in the process, and especially those partners who are most impacted by the forces that create health inequities. I think that it's critical for multiple types of data to be used to identify both strengths and needs. That's sort of the definition of an assessment, is looking at the same question or the same problem from multiple angles and bringing multiple sources of information to decide what's going on in a particular situation. So we think that that's a really critical piece, is that you're using multiple types of data. We also think it's critical that the process is completed without deciding in advance what the outcomes will be, so that the evidence is used to solve priorities and set objective targets. That can be so challenging to do, because it's not like this is starting from scratch here. You know, the whole system is operating as it's operating, and funding is being used to address really important needs and priorities now. So when your data tell you that there's something emerging, or there's something different, or you've made a lot of progress here but not so much here, it can be really challenging to think about how to address those other emerging or different needs. And we're hopeful that this process will be supportive of thinking about how to do that with Title V funding, but also thinking about funding for maternal child health broadly, addressing your needs broadly. The other sort of critical feature that we identified is that strategies for improvement are grounded in evidence-based public health practice. You know, we're always learning so much about what works and what doesn't in addressing community health and public health challenges, and going back to the evidence base on a routine basis can be so supportive of making faster progress toward your goals and objectives and meeting your targets. So we balance those ideas about what we think rigorous needs assessment looks like with a flexible approach. In our very first conversation, that was one of the pieces that I heard from Trudy and Robin, is that we really need to think about what's already in place, and we really need to focus on what's going to be feasible to do with these funds. As we said, you know, recognize that some health departments have had the benefit of resources and supports to do a lot with needs assessment already. Some of you have done your community health assessments, health improvement plans, or worked with hospitals on a CHNA, and you already are well underway in thinking about what needs assessment means and looks like within your community. So we want to make sure that in communities where you've made that progress, that this is supportive of, linked with those existing processes, where that's logical and where it makes sense to make those connections. So one of the features of this process is that if you've already completed a step of the needs assessment process, if you've already done something, there's no need to do it again. What we'll ask you to do is share what you've done, what you have in place, and then just keep moving forward based on that information or that piece that you already have well underway in your community. We also know that there's health departments who haven't had the benefit of the resources and supports to move forward with health assessment activities and health improvement planning activities. And if this is the case for your department, then that we're hoping to support you with is just taking a step forward into this work. We're not asking you to tackle every piece at once. We're not asking you to take on you know, more than is really feasible or practical right now. And we'll work with you in thinking about what does make sense and what you can do to use data to inform priorities and set targets and action plans. Our intention is to be very flexible while also supporting achieving those kind of broad ideas about what we think needs assessment looks like. Okay, so as we designed this process, we were informed by several things, and I'm going to share some of those things with you. any of you already know, the National Association of County and City Health Officials has a model for community health assessment and health improvement planning called MAP, Mobilizing for Action Through Planning and Partnerships. The steps that we incorporated align very closely with MAP steps. So if you're familiar with MAP, if you're using MAP, a lot of this language and ideas should be very, very familiar to you already. And if you're not familiar with MAP, hopefully going through this process can be a step into just kind of seeing what that model looks like, seeing if it makes sense for your community, and potentially creating some groundwork for building in other pieces to your health assessment activities as you have time and resources and space to do so. Also looked, of course, at the Public Health Accreditation Board's expectations for community health assessment and health improvement planning. You know, our hope is that this can be supportive of capacity building and aligned with sort of the bigger goals within public health and within many departments in Michigan. So we're thinking about that as well. Many Great Start collaboratives across the state last year went through a home visiting exploration and planning process. And some of the features of this process are very similar to that process as well. One of the things we noticed in that was that it was really supportive to kind of take one piece at a time, one step at a time. So we would share what the first steps look like, and then communities would go out and complete that step and tell us about what they did, and then they would take the next step. And kind of breaking it up into those bite-sized pieces they felt was helpful. So we're borrowing from that idea and moving forward with this process. Borrowed quite a bit from the Life Course Metrics project. It is a project that's been ongoing for several years at the state level to understand how to use data in a way that's reflective of what we know from life course theory, which emphasizes that the phases of the life course impact one another. So my health as an adult is impacted by my health as an adolescent, which is impacted by my experiences as a child, which is influenced by my my experience as an infant, which may have been impacted by my mother's experiences when she was pregnant or even before pregnancy. So there's the intergenerational idea, and also the idea that we can't understand health outcomes without understanding what's happened in folks' life before they're at the point of experiencing that outcome. Life course theory also emphasizes how system and community forces influence health behaviors and health outcomes. So if you're familiar with the tree analogy, it's that idea of when we see a health outcome like cardiovascular disease, we can understand it best if we think about the behaviors that led to cardiovascular disease, and we can understand those behaviors if we look at the context in which a person lives, and we can understand that context best if we look at sort of root cause of the way our systems are structured. Life Course incorporates kind of both of those ideas, and we've been using those ideas to think about what metrics are that are reflective of a life course approach. And so the life course metrics and that idea about life course is very sort of influential in this process and part of the way we're thinking about this process. So when we're looking at the block grant transformation or looking at the way we'll be looking at data within this process, you see phases of the life course reference, that language is used of phases of the life course. And when we say that, these are the kinds of phases that we're thinking about. We're thinking about the time before and between pregnancy. We're thinking about during pregnancy and right after pregnancy. We're thinking about infancy and early childhood, adolescence and adulthood. And we are looking at metrics. We'll be looking at them across the phases of the life course at multiple levels. So we're looking at data that tell us about health outcomes, data about health behaviors, about social determinants of health, data about direct and enabling services, and we'll be also exploring public health system data. And as I talk through this sounds a little bit overwhelming, and we're working very hard to think about how to work through this in a manageable way. And so bear with us if it sounds overwhelming right now. I think that as we get into it, I think and I hope that it will make good sense to you, and be supportive of probably how many of you are already thinking about community health challenges and tackling them and understanding them using data. So a brief overview of the process that we'll be going through. You've heard already, MDHHS has partnered with us at MPHI to facilitate the process. We'll be beginning in January 2017 and ending in September 2017. The way that the process will work is that we'll walk you through each step of the needs assessment, introducing a step at a time. Once we introduce the step, you'll kind of go off and complete the step, share what you discover back with us, and then we'll move on to the next step. So the step will be introduced with webinar. The webinars, as we've said, will be recorded and distributed for anyone who can't attend on that date and time, or they'll be available, of course, if you want to watch them for a second time. We know we can email out a link to the webinar, and we're also looking for a place where we might be able to post it online just to make it a little bit easier to access it whenever you need it. And we'll announce that website when we figure out exactly what that's going to be. As we're going through this process, you'll complete a needs assessment tool that we've developed and actually are developing currently. It's not quite ready yet, and the way that we'll release it is one step at a time. So again, we'll complete a webinar in a step. We'll show you what the step looks like sort of in writing and on paper. You'll complete that step and fill in the pieces and send it back to us, and we'll take a look at that and give you any feedback, observations that we note as we go through the work that you did. I keep saying steps, and the steps are on the next slide. Okay. And I'll walk through these one at a time, just to overview a sense of what each of these steps will involve. So our first step is organize for success. Next will be engaging community partners. The next step is visioning. Next you'll be gathering and interpreting your assessment data. You'll use that data to identify strategic issues for your community. You'll develop goals and objectives, and then you'll develop strategies and an action plan. And for those of you who have engaged with using the MAP process, this will look really familiar because these are the stages for MAP as well. Just a brief overview of each of these steps. In the rest of the process, you will work on identifying an existing group of system partners that's really focused on maternal child health within your community. I know a lot of you already have a group of this nature that gets together, talks about maternal child health issues and challenges, partners on solutions. If you have a group like that, that will be the kind of group that you identify or name in this step. You'll also figure out who's going to lead this process for your health department. Whose decisions, who's going to send out meeting invitations, who's going to complete the tool and keep the process moving forward. You'll decide how the community members most impacted by the root causes of health inequity will be authentically involved. So like we said at the beginning, we're hoping that for each of you there will be some community engagement in your process and a way for the voices of the folks that you serve to be heard in the process. You'll have a timeline, and we'll have a sort of rough timeline for you to work from, and you'll identify barriers to the process for your community, constraints around time, staff ability, funding, that sort of thing, as well as the strengths. What have you already done? Where do you have some data capacity? Where do you have partners that really have good connections with the community and can bring that voice to the table, things like that. Step, you'll engage your community partners. So this follows really neatly from the first step where if you don't have a group in place, you will figure out who you want to involve. If you have a group in place, tell them about the process, ask for their participation, and think about how they can support the work. We'll have some resources for you that kind of help you think about how to talk about this, share its purpose, share how folks will be involved, that you can work from and modify to meet your needs. Also identify more specifically what community members who would be engaged in an authentic way in the process and how you'll support them, and you'll make those invitations. And steps, you'll develop a vision and values. I know people tend to have mixed experience with visioning, and we'll try to provide a couple options for visioning processes that will hopefully make it a meaningful conversation amongst community partners. Some of your groups may already have a vision that you are really connected with and feel good about and want to work from, and just as with all the steps, that's perfectly fine to work from where you are. If you don't have something in place already, as I said, we'll have some suggestions for how to come up with a vision. What we think is really helpful about this process is just having a conversation about where is your common ground, where are you headed together, what do you want your community to look like in the future. That can be a really powerful touch point for a group. They work on a process that can be sometimes demanding and hard, and it can be helpful to have that touch point. You'll also talk about how you want your group to work together. They're helpful as well, just to have those principles of how you're going to partner thought through can be supportive of a group's really good functioning over time. Next step 4 is the assessments, and for this we are envisioning three types of assessments. So as I said at the beginning, one of the ideas is that assessment really involves looking at the same question from multiple angles, and so these are the 3 different angles that we're thinking about looking at the issue of maternal child health needs from. First is the maternal child health status assessment. So just like with MAP, you'll be looking at some population data. So what we're doing right now is thinking about what core metrics we want to recommend and what ones we want to require you to look at as part of the process. We're also working with at the state to figure out how much of this they can populate and share with you directly. There's, of course, local data that they don't have access to. So you might have some program data that you find really useful and informative, or a local survey that you use at a local level. And that's great, and we want you to use those things. But we also want to make it really easy to access data that the EPIs at the state have really direct access to. So things that are in vital records or at the state BRFS. We want to provide as much of that for you as we can at the point of this step. Look like is that you'll receive that data, supplement it with any local data that you have, and then look at it together with your partners and decide what sticks out, where are your strengths, where are your areas of need. The second assessment is community themes and strengths, and during this assessment you'll be addressing gaps in your population health data and looking and learning more about what maternal child health looks like from the perspective of community members. So an example of something you might do under this assessment, one of the things that they noticed in the state data, in PRAM's data, is that while Michigan has made really good progress on infants sleeping on their back, we've made less progress in the area of infants sleeping in a safe environment. We know that PRAMS data are not available at the local level unless your community happens to do a PRAMS or similar type of survey independently. You possibly have some of that data from another program that you're running, or maybe one of your partners has this data, but we think it might be a hard one for you to look at directly if one of your concerns is around safe sleep. So during this assessment, you might pull together a group of new moms and get a focus group with them. Ask them about their challenges with sleep. Ask them about what their strategies are, what they think about messaging that the health department's been doing around safe sleep, that sort of thing. So it's just a way to talk to your community partners, listen to community members, and learn of things where know you have gaps in your understanding based on the population data that you do or have access to. That's just one example of something you might do, and there's a lot of flexibility in this as far as what you focus on, what method you use, and we'll try to provide a lot of ideas and resources about the different strategies that you could pick up to complete the assessment. This assessment is a maternal and child health system assessment. What we're thinking about here is putting together a guide for you to have some discussion with your community partners about how services are delivered within your community, and to identify some of those infrastructure strengths as well as infrastructure gaps. So, you might discover that around assessment and planning, you're really strong, you have strong engagement, you have good access to data, you have sort of status reports you find really informative, but you may at the same time that in the area of policy development, your health department hasn't had very much forward movement, that you haven't been thinking too much about workplace breastfeeding policies or any of the other sort of policy work that a health department might engage in. So just a way to identify those pieces of public health infrastructure that you have in place and where your gaps might be. And then primarily just through a discussion with your community partners that will be guided by a tool. So you'll be interpreting your assessment data. So as you complete each of these data gathering activities, you'll bring together partners and look at your data and say, this is what we think this means. This is what we're seeing in our data. And you'll summarize those key findings after each assessment. And you'll use that summary of what you find in the next step, step 6, to identify strategic issues. What you'll do is you'll look across those 3 assessments for themes, for things that really stick out to you, and for findings that are related to one another across assessments. You'll take those themes and phrase them as questions about your community, questions that if you had answers to them, you would you would be able to identify strategies for improving maternal child health. Prioritize those strategic issues you identify with partners. Again, if you're familiar with MAP, this is very consistent with the MAP process for turning data into a question that you can answer and a strategy that you can use to move forward. Instead, you'll develop your goals and objectives. Write one goal or broad statement of what you hope to achieve for each strategic issue, and you'll write a SMART objective for each goal that includes a baseline and a target value. When we get to this step, we'll really encourage you to do something that is manageable. You will probably identify more challenges than you can tackle, certainly with Title V funding, or challenges that your health department can tackle around maternal child health right now. And we're definitely not going to be asking you to bite off more than you can chew. So the idea here will be to come up with goals and objectives that you think are important and meaningful and will move your community forward, but are also reasonable and doable for where you're at right now. You might notice that this is a lot of time and resource and energy into understanding what challenges your community is facing and figuring out what your goals are. All of this will happen before you're even starting to think about what your solutions are, what actions you're going to take. Like this quote from Einstein, if I had 60 minutes to solve a problem, I'd spend 55 minutes defining it and 5 minutes solving it. And that's what this process is going to feel like. You're going to spend a lot of time figuring out what the problem is, what it looks like, what it means, and then at the very end, in the very last step, you'll think about what are the strategies that we can use to solve these problems that we've identified. So in the step 8, you'll identify your strategies and develop an action plan. So that will involve some brainstorming of potential strategies, figuring out your priorities, and developing an action plan. So the steps of the process that we've envisioned. And again, I just want to reiterate that principle that I started with of we know that some of you have already done substantial pieces of this, and that's awesome, and we want this to supplement, replace, or create rework. And we know that for some of you, this is a huge, huge ask, and it might feel a little bit overwhelming. And for in that situation, again, we want to emphasize that our intention is to figure out how to make each of these doable, to take you a step forward to a meaningful contribution to how you think about maternal child health in your community, but not be overwhelming or so much that that it just feels like you can't do it. So our intention again is to be very adaptive to where you are and to help you think about how this fits in your journey around health assessment and assessing maternal child health needs in your community. right there in case anyone in the room wants to, is there anything that I didn't say that I should have said or rushed through that you want to comment before we talk about next steps?
Calling in, is there a PowerPoint that you sent with this?
We're happy to send you the PowerPoint. There is a PowerPoint that we have on the WebEx recording, so you'll be able to access that on the recording, but we can also just send you the PowerPoint.
That's just because I couldn't access through the WebEx.
Okay.
Thank you.
Absolutely. Shoot us an email and let us know. We'll read the email out loud so you can write it down when we get to the end.
Well, thanks, Robin.
This is
Julia. Thanks, Julia.
Yep. No problem.
Pretty comprehensive, Julia. I can't think of anything else I need to add at this time.
No, either, except to just reinforce what Julia said about, wanting to be as flexible as possible. If there's anything about any of the steps that you have questions about, or not sure if you have something that already might fulfill that step, certainly reach out to any of us on the team, and we will talk it over and figure it out. So just an open line of communication with all of us here.
Thank you. So we'll talk about next steps, and then we'll have time for questions in case any of you online have questions you want to ask right at this time. So next steps. We'll be publishing the webinar schedule. We're just finalizing the last couple dates. We want you to be able to get those on your calendar as soon as possible. The next webinar will be January 4th from 11 to 1, but soon we'll be releasing all of the dates so you can go on your calendar. So with that first webinar, we'll actually be releasing step 1, 2, and 3, so you'll see the guidance around all 3 steps at that time. We'll be talking about those 3 steps on the first webinar. That was the ideas of organizing for success, where you're bringing your stakeholders together and doing your planning, inviting your stakeholders to participate, and then doing your visioning. Since we're guessing that many of you have maternal child health groups in place, we want you to have information about all those 3 steps as soon as you can in case your groups are meeting in January, that kind of thing. So that will be the plan for that January webinar, is to release the 3 first steps at the same time. If you want to jump in early, certainly you have to, but if you want to jump into this, we would suggest that over the next 3 weeks could identify anyone at your health department who you should know about the process. Maybe you have an accreditation coordinator who doesn't know about it that might be interested in this. Maybe you have someone who coordinates assessment for your health department that you might want to involve, or you have epidemiologists or evaluation staff that you might want to get involved. If you have any thoughts that way about folks you might want to just say, hey, this is happening over the next several months, you could certainly start that communication. That first step, part of it is identifying existing groups of partners that would be right for this work. Start to think about that if you want to, but certainly you'll have time after that first webinar to do that as well. Kind of having an overview of what this looks like, you can start to think of any potential linkages with your health department's existing CHODSHIP or planned CHODSHIP if that's where you're going right now. Okay, I'm starting to lose my voice a little bit. I'm getting a little froggy here. This might be a good time to just pause and hear any questions that you might have. Yeah, in the chat box, or you could unmute. Oh, we're muting here on WebEx, so we might have to unmute here. But you can put them in the chat box, or I'd be able to ask them over the line.
Questions that we've been from a couple of health departments that might be helpful for us to hear is, can they use the funding to support a consultant working on this process? And our answer has been yes, you can. So that might be an idea for those of you that are considering to go that route. Anything, Robin, anything else that's been asked by other health departments that might be helpful to share right now?
which I think we've answered in this webinar, is that some health departments have been concerned that they just completed an assessment or they are, in the process of an assessment. And again, as Julia already stated, we want to work with where you're at. And we get the MCH assessment tool that we're developing will maybe help you think about things in a different way. We don't want to, have you redo something or do what you've already done. So just to reiterate, that was a question from a couple of departments. And people are concerned about, could they use the money for staffing? So you can use it for staffing, hiring a consultant. I think people asked whether they could use it if they wanted to use incentives to help gather community partners or family engagement, and allowable to use a small amount of the money for incentives, but we wouldn't want you to use the bulk of the money for incentives. So if you could do something like that, that would be allowable.
One question typed in: where will the webinar be archived? Access to listen if a portion was missed. So we will immediately be able to email you the webinar. We are identifying a location where we can post it online still, but we will let everyone know when that location is identified and send it out over email. But if you would like us to send it to you directly, shoot us an email and we'll send it your way. Lauren, do you give everyone your email address so that they have it in case they don't?
My email address, if you would like to have the webinar sent to you, is lladine@chi.org, and I'll put it in the chat box as well because there are a few people saying that there's a lot of background noise.
So if you are not talking or trying to talk, we unmuted everyone from on the WebEx side. So if you could mute your phones, that helps with background noise. And let's do a question, which you were invited to do.
Well, maybe we'll take this opportunity, or take this as a sign that you think that we've set out is a reasonable project, and that it was laid out very clearly, and there aren't any questions. Any comments or thoughts or reactions, or absorbing everything and kind of taking it in?
Question.
Question two.
You mentioned you're going to have data available, or try to have some data available. Some of the POR data that was once available be one of the items that we might be able to get from the state.
That is absolutely one of our goals and one of the things that we've been working on.
Far along are you so that we can maybe get that?
Well, the PPR data analysis, just to say we can give everybody it in the state, is a little challenging because it might need to be released normally by county because of the nature of the PPR analysis and the number of events that you have to have. So well, about the data, we'll be able to give you more information about the PPR analysis. We currently have that by a regional level, so.
Okay, thank you.
And right now, and Julia, tell me if this is incorrect, with the schedule that you put forth, we're thinking that we would get as much data as we can out to folks by March.
Yep, that is the plan.
I have a question
March,
regarding.
No, I'm sorry.
I'm wondering, we're from Kent County here, that what are the maternal child health services that you're talking about in this health system assessment? A listing?
When I'm referencing the infrastructure or maternal child health systems and services. What I'm talking about there is the 10 essential services. So 10 essential services for maternal child health, 10 essential services for public health. They're very similar in their wording and language. With the Title V block grant, they have an image of a pyramid, and at the top it's direct services, then enabling services, then public health systems and services. Those services that are in that bottom box. So it's assessment and planning, policy, enforcement, evaluation and quality improvement, those types of things.
That's helpful. I have one more question in regards to Kent County received a City Match Equity Institute three-year project to look at maternal child health outcomes, and if we could use some of these dollars to collaborate that work to do more of a drill down of, because we've identified African American population as a target, and if we could use some of these to drill down more in that particular population, more than broader, or both.
That's an interesting question, one that we might have to tackle with you individually, kind of offline, just to kind of learn a little bit more about where you are kind of broadly and what other pieces of this you already have in place, and kind of how this might fit in. We really want to think about alignment and connection and how this supports what you already have in place, but I think that those will probably be like kind of individualized conversations. So thank you for asking that today, and I invite anyone who has a situation like that to bring forward what your ideas are and where this fits with what you're doing, and we'll kind of think through how to make that work.
Thank you.
You're welcome. We have a question that came in the chat box. I missed your answer about people who just finished their assessment. Do you expect that they use that data and supplement with additional qualitative and system data specific to MPH? It's probably a very logical way to think about this process. What we would, I think that probably will encourage everyone to do is participate in webinars and review the pieces of the tool as it comes out. And as you're thinking, gosh, we just did this, we have something in place in this area, share back with us, and then focus on those pieces where you haven't done that work yet, and submit to what you already have. So again, it'll be kind of an individualized look where you are and how this fits. But yes, that is definitely the general concept of it. If you've already done something, then work on the things that you haven't done. Are there questions this afternoon that we can address?
Hey, Leah, this is Jill.
Hey.
I haven't talked to you in forever. How fun this is going to be. Kidding. I wanted to let you know there's two projects that are going on that we're involved in. There's an infant mortality quality improvement project where we're actually working with MSU, the university, and resolving some infant mortality issues. Then there is a second group called the West Michigan Perinatal Alliance, and that particular group is also working on infant mortality and maternal and child health issues, but that's based in the prosperity regions. Are you aware of those two projects? Because there's a data collection piece that's going along with those two.
I'm not aware of those projects.
I am aware of the West Michigan Perinatal Association. Is that what it's called? Association? Southern Region 4 Perinatal Care System Development Project that my colleague John Schenefeld and Paul and are working on. So we're familiar with that. We know that they're data collection as well.
Right.
I'm not sure which quality improvement project that you're doing with MSU. Is that related to just your agency or the region?
It's actually a statewide project. All those folks that get maternal and child health funds were asked if they wanted to participate. Let me see, Laura Houndshell. Do you know who she is? Laura Houndshell,
Are you talking about the community of practice for preterm birth and the smoke? You're one of the areas participating in that. That's what it is. I think it's the community of partnership. So it's called community learning, community of practice learning. Where you
right, it's a learning collaborative for quality improvement. So there's data that's being collected there too. So, and pretty sure that all the agencies that are involved are not just from our area. So maybe we can figure out somehow how to get this together. Because it's a lot of data collection for a bunch of projects that are actually pushing for the same thing. I guess is where I'm going with that.
That's really good. There are so many overlapping ideas and initiatives out there, and we definitely want to think about where there are connections and certainly where there's good access to already. We would want you to pull from that data and use that data. Not reinventing the wheel or creating something from scratch when you don't need to do that. So thank you for letting us know and mentioning those other initiatives that are going on.
Okay, so since I'm involved with both of those projects, as I see things coming along, if I see things that look interesting, I'll just forward them to you, okay?
Perfect, thank you.
I have one more quick question about the listserv and getting connected for information. So probably in our health department, and I'm speaking Kent County, have some folks that they aren't tied in with just the maternal child health funding working on the process, and so I just want to make sure that the right people are getting the information about the project.
We want to make sure about that too. So we send out the local MCH work plan that you're going to upload on eGrams. There's a cover page, and it has a place for the local MCH contact person and whoever you want to be the contact person for the MCH assessment if it's different than the local MCH contact. I think I should probably put space to one person. Whoever you need to have on that listserv, we're happy to add to it. So.
Okay, and who will be receiving the template? Will that be?
Send it out to the local MCH contacts because those are the contacts I have right now. If you feel like your finance person is the person who has to upload that onto Gram so that we have that process in place for our local MCH plans. If you think you want to do something differently, just please let me know. I'm happy to send whoever needs it.
We'll collaborate with those folks and get the right people tied into it. Thank you.
Okay, great.
Other questions this afternoon?
What is there a question? No, same one. Oh, that is okay. Mm-hmm. If there are questions, I would be curious to hear your reactions. I was just sitting and they did a little popcorn response, like a little one-word response to what you think. So there's no, people can just chime in something so we get a sense of where you're at. I'm really excited. I can say that I'm losing people. Sounds like people are exiting the call.
There are no more questions, and we'll assume that at least that people are, will have a chance to really kind of look this over more closely And if you have any questions or concerns or comments, that you will reach out to us the next few weeks.
We're really looking forward to working with you on this, and be safe today and have a very happy holiday season.